A Minnesota woman with a mission to hold Big Pharma accountable after her husband's death. How the Make America Healthy Again movement could finally make that happen. Next. Kim Witczak is my guest. She calls herself an accidental activist. Good to see you again, Kim. Thanks for being here.
Great to see you too. Thanks for having me.
Just to give folks some background here, it was 18 years ago, back in 2007, that you spoke the following closing words at a U.S. Senate hearing on FDA reform. You said, "It is said that the history of the FDA is written in the tombstones of drug and food safety disasters. Stop the march of tombstones. Do what is right for the American public." Your husband, Woody, died in 2003, just 5 weeks after being prescribed Zoloft. In many ways, Kim, you've paid the ultimate price. You've been fighting ever since to protect others. You're so admirable in all you're doing for all of us. But it's why we wanted to have you back on here. Do you finally feel now, Kim, that there is hope with this new administration and specifically with RFK as Health and Human Services Secretary?
Yes, well, hope is one of the things I've held on to since Woody's death in 2003. It's the hope of that I feel like we finally have somebody that might be in the office that will help get to the bottom of the disasters that we've had at the FDA for a long time, and the ultimate price being paid are the people like Woody who have paid for the failures. So I feel hopeful for the first time that we actually have somebody that has the right intention and will actually do something about it.
We spoke in greater detail, it was a couple years ago, about Woody's life, his death, in our previous conversation. I hope people can go back and listen to that. But you've been fighting, as I said, to warn others what you didn't know. Tell us about the black box warning, on some of these drugs now, the progress that has been made, specifically with psychiatric drugs on the market.
Sure. Well, for viewers who don't know, black box warning is the most serious of any of the warnings that the FDA can put on a medication, which usually means there's a death or serious harm associated with it. So we fought like hell to get the black box warnings on antidepressants back in 2004, 2006, because unfortunately those warnings didn't exist at the time that Woody got put on an antidepressant. So, as much of a victory as it was also kind of bittersweet, again, for us because we didn't have that warning. But to think to this day that the warning for the dangers of antidepressants still does not extend to all ages, and all ages need to be warned. And so that is why I think this constant reminder of telling the public about the serious side effects and potential for harms from these medications is so important, no matter what age you are at.
And let's talk more about those serious side effects. You serve as a consumer representative on an FDA advisory committee, which has opened your eyes. But on WoodyMatters.com, people should also follow you on X. It's Woody Matters as well. But you say an estimated 128,000 Americans die each year as a result of taking medications as prescribed. It's the fourth leading cause of death among Americans. But how eye-opening has that committee been for you to see just the inner workings of the FDA and the money, I guess, at stake here?
Sure. Well, first of all, I think it's fascinating, that I have a seat at the table, because this was the committee that in 1991 first investigated the emergence of violence and suicide with Prozac, did nothing. So now it's come full circle, and I sit on that committee as the consumer representative representing the public. So I get a firsthand view of how drugs come to market and the discussions that happen around the clinical trials. Well, one of the things that I never knew is I assumed that clinical trials were done by other people besides the drug companies. That's not true. So to get a drug on the market, those initial clinical trials are done by the pharmaceutical companies. And so that's one thing. But a lot of them are using something called fast tracking mechanisms. So they're coming onto the market faster with less, we've always been told that America has the gold standard for approval, which means that we have 2 double-blinded placebo-controlled studies. Well, that is not true. A lot of the new drugs are using these fast-tracking mechanisms. So, and that's one, that was one aha. The other is harms the harms, the discussion that, the risks of medications, it's always an assumption it'll get caught eventually down the road. Well, it's hardly ever discussed at the meetings that we have. And if it does, it means that there'll be the drug company or the FDA will be told, hey, let's put a REMS, a risk elimination mitigation strategy, which basically means that you'll try to have some programs in place when the drug comes on market to help capture some of the harms. But as we know, and as we've seen with numerous of the drugs that have had safety issues, it's often once it's on the market and it takes years before warnings, like antidepressants. It took them, that was 1991. The next time that a warning actually got placed was in 2004. That was 13 years after the FDA first talked about it. So that is the one thing that I'm always on this committee and I want to talk about is I keep bringing it back to harms, because, you got to remember clinical trials, it's a business and they use the FDA. It's a hurdle to get the product on the market. But the real clinical trial is once it goes into the marketing and once you and I, the everyday person, and it goes into the system, we are the real clinical trial. And so it's why I try to always bring up harms on my committee and talk about it. And because I know what's going to happen down the road.
I know in your time you've also seen the media change. You've talked about this, whereas a story like yours used to be reported, investigated. Then it seemed that the bottom line broadcasters seemed to care more about. I wanted to hear more of your insight there, and also how RFK has said that he supports banning Big Pharma ads on television, assuming you do as well, Kim.
Sure. Well, it's funny. When I look back at the time when Woody, I was very fortunate in that at least Woody's story was told in the mainstream media because that was our media that we had out there. I mean, granted, it was always the small byline, but at least there was the for most of the time the media still always promoted the benefits, which is kind of the system that I've learned. But at least they did talk about the other side of the drug or a problem. And I've come to realize that when I learned that the U.S. is one of only 2 countries that allows drug ads, period, well, that ultimately does impact, an advertiser. I'm still in advertising, so I understand how the advertising game works and how media works, and I know the power of, how the trickle down, whether it's the networks that rely on the advertising revenues. And they say that it keeps, church and state separate, from the news and the advertising departments. But the truth is, it does impact what actually gets reported. And so that's one thing. So for me, I have 100%, I've been advocating. There were hearings back in, I think it was like 2008 on direct-to-consumer advertising. And I was out there back then speaking on how we need to get rid of it. And I remember telling the owner of my agency, Pat Fallon, the late Pat Fallon, that I was going to go out and I'm going to speak against our industry. And at that time, all of the advertising industry publications like Adweek, Advertising, Ad Age, they were there covering it because they know it is a big impact on the business of advertising too. So I am 100% for getting rid of drug ads and support, RFK for wanting to get it off because I think it adds to this whole problem also for consumers that, we see it advertised on air, which I know I did. I used to think this way. That, if it's advertised, of course it's going to be safe and effective. Like, there's this, it has so many, not from the business side, but also what it does to the consumer psyche. And then you have to go to the doctor and you still need a doctor, as your middle person, that you can't just go and buy it at Target. You have to go through a doctor. So it also then plays into the overutilization of our healthcare system.
As this Make America Healthy Again movement has gone more mainstream, give us, say, top 2 or 3 things from your perspective that would, you could focus on right now, change right now Because it almost does seem that there is a lot of noise. Just the deeper you dig here.
For starters, I love that the MAHA Commission is actually, for the first time, one of the things is looking at the role of psychiatric medicines in the increase of mental health, because our mental health crisis is growing. So I love that that is one of the initiatives. So I'm 100% behind that. The other couple would be informed consent, because I think informed consent is really the foundation of anything that we're doing, which means that we have to have the good, the bad, the ugly. And if that means that if we don't know everything about, say, the vaccines, which has not really been my area of advocacy in the past, except for when COVID started, that's really when my eyes became awakened to that system. But, we need informed consent. Like, if we have not had clinical trials, like, let's go in there and investigate, right? So I think that has to be a part of it. And then the third one that I think is really important is we need to reverse liability for the vaccine manufacturers. The fact that, I remember being shocked with COVID that they gave companies like Pfizer, who was the company and the manufacturer of Zoloft, which is the drug Woody was on, I was able to hold them accountable and have a wrongful death failure to warn lawsuit. So I was shocked that our government gave these companies, like one of the most egregious companies out there, complete legal liability free, so as a consumer, if something happens, you can't hold them accountable. But then when I learned that in 1986, I believe it was, that our government gave the vaccine manufacturers liability free, and that's when the number of children's vaccines skyrocketed. And what other industry do we have? Car company, like all the businesses I work with, the automotive manufacturers, the retailers, technology companies, they all have, if something happens and they have a product that's out there that puts defects in, you can hold them accountable. But the fact that we have something that we're putting in our bodies and we don't have liability, or we can't have no protection, so that is another thing. Like, we got to get rid of that. And because I know I've heard people, they're saying, well, companies, it would bankrupt them if we didn't have this. Well, that was back then, and that's not the case anymore. We know this, so let's get that done. So I'm in full support. Those are three, and of course, I could go really deep into all of the other things that I support as well.
I know one of those, your focus has been on kids specifically, but 1 in 4 adults, 1 in 12 children are on psychiatric drugs. 1 in 3 teenagers is engaged in mental health treatment, often reduced to nothing more than medication management. As you say, these numbers keep rising. We continue to manage the problem with more pills, as you've cited before. But that's also a message from you that it's okay to not be okay, and we don't have to reach for the pill bottle in order to feel better.
Right. It's funny, that idea of, we have, through, I believe, advertising and this quick fix culture, we just want a pill to take it and make it go away, right? And when I started really looking into the mental health industry, because it's an industry, make no, it's not just pharmaceutical, it's everybody in between. It's an industry that is keeping people actually sick. And so when you start looking at the rise of the use of antidepressants and our mental health is going like this, something's not working. And so we do need to take a step back and also ask if some of those programs that we put in place, like Make It Okay, that put all this focus on mental health, actually has made it worse. Because at the end of the day, there are, when Woody died, I'm supposed to hurt. But when I went to the doctor and the doctor said, well, do you want something so you don't feel? I'm like, well, I think I'm supposed to feel, like he died, right? And so this idea that we need to almost reshape the conversation around what does mental, and I don't even like saying mental health because that implies a sick model. I like to say, what does mental well-being look like? What does it mean? And if we are mental, spiritual, physical beings, we've tried to medicalize and make depression, sadness, anxiety, all these things that are a different part, and we've made them out to be physical. Like a pill is going to fix it, like you're going to take, and they always try to equate it to like a cancer. You're not going to tell a cancer patient they can't have treatment. Well, that is a very much of a medicalized model, and I think we need to kind of take this opportunity to actually ask different questions.
Your husband, he went from not sleeping to hallucinations, then hanging in just 5 weeks, as we said. But all along, you have seen God moments. I think that's really a powerful part of your story that I know you're comfortable talking about as well. But even, talking about young people to realize how that spiritual health sure does play a role.
Yeah, first of all, I think back after Woody died. I grew up in a family of faith. I didn't really understand it probably at that point, but when Woody died, it was the only thing I had to hang on to. And I remember that simple prayer of trust me, I was like trying to rip my heart out, and I had scratch marks because heartache's real. This is all real. But I remember praying, take my pain and use it. It does me no good. And so that kind of started this whole journey that I did. And then, I had the Bible floating when we were throwing Woody's ashes out. So I've had some real big God moments that have said, oh, trust me, it's bigger than what, that you're thinking. But I also, through the worst time of my life, the pain of losing Woody, I also found that you have to, once you go through, and I always say it's kind of like a big tunnel through a mountain. It's dark, 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 dark. And dark times are kind of like where the growth is manifesting inside, right? And eventually you see a little pinhole and a little bit, and the light gets a little bit bigger, and then you get through. And then on the other side, it doesn't mean that the grief didn't exist, because that is still there. This is part of your life now. But that when you get on the other side, there's confidence that comes with it. There's growth that comes through the dark times, whether it's, and I always say, through the worst time in my life, I found my voice. I found who I was and what I was capable. I didn't think I was capable of any of this before Woody died. And so my message to young people is, what if we reshape and retell different stories around the hard times and not quickly go grab a pill? Because, at the end of the day, unless you're willing to still face it, you still got to look in the mirror. It doesn't go away. And so what you resist persists. So at some point, you're going to have to look and deal with whatever it is, whether, your friend just got mad at you, you lost your job, you had a breakup. I mean, how many times the families that I had met back in the day, what were they given antidepressants for and had the absolute worst result because they had the ultimate death? Were breakups. They had anxiety because they just graduated from college and they didn't know what they were going to do next. So they went to the doctors, and those are natural situations in life. And so I really want to, give people that ability to give themselves grace to pause and be okay not being okay. And knowing that you're going to, and if you surround yourself with faith and the people and community and the ability to talk to somebody else, you'll find that you're actually not the only one going through this. This is part of being human.
You've also said that it's time to stop playing politics with people's lives, and that MAHA isn't red or blue, but it's purple for people, which I love that, and so true, right, Kim?
Yeah, so it's funny. I have noticed, in all my times going out to DC, we've had different people in power, like the Republicans were in power, then the Democrats were in power. And I remember it was kind of my first aha is when the groups, people we were working with, oh, you can't go talk to the Democrats or you can't go talk to the Republicans. They won't help you. And I remember what? Why? I mean, this isn't about a red issue or a blue issue. This is literally the intersection where red and blue overlap, which makes purple. And I say purple is for people. And that's what I love about the MAHA movement is it really has brought people from all sides. It's not a political thing. So when I see it being politicized, I'm like, Oh, no. Like, you're not for wanting people to be healthier? Like, help me understand. Like, this is about people, but and it's why I've also intentionally have stayed out of politics and putting because this is an issue that I got to stay focused because it impacts all of us. All of us are going to live. It doesn't matter what color you are. It doesn't matter what your beliefs are. We want to make sure that the medicines that we are being given are not only work, because the business is going to tell you that, but that are safe. And so it knows no boundaries.
Be sure to follow Kim again at Woody Matters on X and woodymatters.com. But Kim Witczak, thank you so much for being here. You're one of these brave women in Minnesota I just love to talk to. So thank you so much for everything you're doing.
Great. Well, thanks for having me. I appreciate it.
That will do it for this episode of Liz Collin Reports. Be sure to click the subscribe button here to follow our content at Alpha News, and we'll see you next time.